Welcome back to Cancer Buzz. I'm your host, Summer Johnson. Today, we're talking about patients with HR positive, HER2 negative breast cancer receiving CDK4/6 inhibitors. For patients with this diagnosis, treatment selection should be highly individualized.
So we have a lot of oral options that we can give our patients. This particular population is living a longer time because of all of these options.
Clinical pharmacists play a vital role in managing the patient's treatment.
Because as we know, if you're having excessive side effects, patients are going to be less likely to take their medications.
That's today's guest, Diana Van Ostran, joining us from the Baptist Health South Florida Miami Cancer Institute.
It's all about how you speak to the patients, that comfort in your voice so that they know that they're in a safe space. They can ask questions. It comes with time, especially with the oncology population. Like I've had those conversations with patients. Is this medication even worth it to me? Most of the time, that question comes in the adjuvant setting when patients are taking this medication more so as a precaution, right? They don't have cancer already, but they're taking it as a precaution to decrease their chances of any recurrence. Those patients are the ones that have more of those doubts as to whether or not they should be taking this medication, especially when they hear about some of the toxicities.
What Diana's talking about here is key. CDK4/6 inhibitors in HR positive, HER2 negative breast cancer has become a new standard of care, and it's highly individualized care. Let's talk about that. I've heard there are dose modification strategies to manage side effects with these particular inhibitors. How do you work that in your plan for each patient?
So what we do is we initially educate patients right from the get-go. Then at the 2-week period, I will go ahead and call them again. And of course, like I mentioned, they know they can call me in between as needed. All of these medications have different thresholds, different grading criteria as to when we will go ahead and make these dose modifications. Sometimes we have to make dose modifications from the get-go because the toxicity is so high, right? Like it's rare, but I've seen some patients where we have to make a dose modification after 2 weeks of starting a medication. Usually, the way we mitigate that is we talk to patients. I go ahead and grade their toxicity. Depending on the grading of the toxicity, whether it be diarrhea or whether it be nausea and vomiting, which is more rare with the CDK4/6 inhibitors in particular, whether it be a rash, which is something that I've seen with one of the CDK4/6 inhibitors. We grade that toxicity and then make those dosing recommendations as appropriate. Sometimes we don't have to reduce, sometimes we just have to hold. And depending on how quickly the toxicity resolves, then we will go ahead and make those recommendations, whether give it another try at full dose or we have to reduce. And those are conversations that I have with the oncologist in the clinic so that, together as a team, the oncologist, myself, and the patient can make that decision.
How do you counsel patients to manage their fatigue or their neutropenia or their stomach GI side effects? Are there any lifestyle or dietary tools or techniques that you use?
So part of what I do always is I also counsel patients on different dietary needs, right? Or dietary restrictions and living a healthy, balanced diet as much as they can, right? Especially with some of these medicines, they can already cause, like you mentioned, GI toxicity. And if their diet is already not very well balanced and it's more of a poor diet, they're going to be less likely to tolerate these medications. So from the initial get-go, I try to make sure that they know to avoid foods that they already predispose them to having intestinal issues, right? So making sure they know those foods that to avoid is really key so that if they do have GI toxicity, we know in fact it's the medication and not the fact that it's their poor diet. right? So I really counsel patients on making sure they're emphasizing their diet, drinking a lot of water, eating a good variety of grains, fruits and vegetables, healthy meats, to be able to improve their tolerance of the medication. Now, in terms of fatigue, that's definitely a more difficult one. Fatigue is common, especially at the beginning, right? So I talk to all of our patients about this, just feeling tired, I would say for the first month. And then what I have come to realize is that patients either become more tolerant of these medications or their body just becomes accustomed to it and it just gets better. The fatigue gets better.
Thank you, Diana. You can visit the show notes for resources on managing CDK4/6 inhibitors for patients with HR positive, HER2 negative breast cancer. Those resources were created to support multidisciplinary oncology professionals. Until next time, for the Cancer Buzz crew, this is Summer Johnson.
This show is a resource of the Association of Cancer Care Centers.